Today we will deal with post-streptococcal glomerulonephritis, which is also known as in short PSGN. PSGN is a prototype of acute endocapillary glomerulonephritis. This disease is generally seen in child age group, which is 2 to 14 years, and it is commonly seen more common in male than females. The familial and cohabitant incidence is around 40%. It is due to M-type streptococcus. The strains which are involved in pharyngitis are 1, 2, 3, 4, 12, 25, 49 of streptococcus, while those which are involved for impetigo are 2, 47, 49, 55 and 57. As we see, PSGN generally occurs around 1 to 3 weeks after pharyngitis and 2 to 6 weeks after skin infection. The candidate antigens are SPEB, which is streptococcal pyrogenic exotoxin B, which is actually cationic cysteine proteinase, and this is generated by proteolysis of a zymogen precursor, and NAPLR, which is nephritis associated plasmin receptor. Now, as we see in this schematic diagram of glomerulus, we see subepithelial deposits which appears as hump, and the subendothelial deposits which are granular in nature. We also see some mesangial deposits and polymorphisms. Polymorphs are seen. When we do a renal biopsy, we see hypercellularity of mesangial and endothelial cells. The polymorphonuclear infiltrates. Then we also see granular endothelial immune deposits of IgG, IgM, C3, C4, C5 to 9. And as we have already discussed, the subepithelial deposits, they appear as humps. The classical presentation of nephritic syndrome, we do know that it is hematuria, hypertension. So here also the clinical picture comes, the patient comes with hematuria, pyuria, there are cast seen, that is red RBC cast is seen in the urine, edema, hypertension, oliguric renal failure, and this may lead to severe, which may appear as RPGN, that is rapidly progressive glomerulonephritis. And at this stage we see 5% of children and 20% of adults, they have proteinuria in the nephrotic range, that is more than 300 milligram per deciliter. On investigation, we see there is decreased CH50 C3 complement, whereas normal C4. The RF factor is positive in around 30 to 40%. Population which are affected by PSGN, cryoglobulin and circulating immune complex in up to 60 to 70%. PNK in 10% of the patients. Culture is positive in 10 to 70%. ASO titer is raised in around 30% of PSGN patients. Anti-DNase is around 70%. Anti-hyaluron is around 40%. Rarely we need renal biopsy. Now coming to treatment, the treatment has its mainstay as antibiotics and the symptomatic treatment, and there is no role for immunosuppressive drugs. There is a good prognosis in children, but when it comes to elderly patients, the prognosis is worse, and there is high incidence of azotemia, nephrotic range proteinuria, and end stage renal disease. Thank you.